Carmel, Catania, and I'm going to be validating for IV. I am going to start with my 7 steps. I'm going to check the physician's orders, wash my hands, collect my materials, confirm the patient, introduce myself, explain the procedure to the patient, and provide for privacy. I'm also going to do my rights. It has to be the right patient, the right time, the right drug, the right dose, the right route, the right reason, and the right documentation. Okay, so I am going to be, the first thing I'm going to do is, with the medication, is I'm going to check it. The physician's orders against them are with my medication. I'm going to label it with the hospital label on the back. Place that up here. I'm going to check the patency and make sure that the IV site is without any swelling. Make sure that it looks healthy, that there's no problems with the IV. I'm going to open up my tubing. I'm just going to move the clamp a little closer for me. Okay. Now I'm going to, this bag's been opened before, so what I'm going to do is hold it upside down. These are both sterile, so I'm going to be careful not to touch them. I'm going to open. Again, careful not to contaminate it. I'm going to spike the bag. I'm going to hang the bag and clamp it.
As always, we start with our 7 steps. We check our doctor's orders, we wash our hands, we gather our equipment, identify our patient, introduce ourselves to our patient.
Now what I'm going to do is prime the bag. And you want to prime the bag slowly to try to eliminate as many bubbles as you can, with just a little drip coming out of the bottom.
As always, we make sure our medication expiration date is valid, that the solution is clear, does not have accepted, and that the bag does not have leaks. So open our secondary tubing kit.
Okay, what I'm going to do is just give this a good squeeze to fill it up about halfway. Okay. Now I'm just going to look for a drop. Again, I'm going slow with this to reduce the amount of bubbles.
Our 6 rights of drugs. We have our right drug, that's the right dose that we're administering it by the right route, at the right time, to the right patient, for the right reason, and then we're going to document everything as well. And also, when we deal with medication, we check your 3 label checks. We did our initial check, we did our secondary check before we spike the bag, and we'll do a 3rd check before we administer it to the patient. So we're going to lock our clamp.
Now what I'm going to do is get an alcohol wipe. To clean the patient's.
We're going to fill out our label with our date, time, and our initials on the tubing.
What I'm going to do is label the tubing.
We have a short tube, we're going to prime it over here.
With the date and tubing.
Save that.
Okay, so my patient, I've already assessed the site, so I know that he's fine to receive the medication, and I've checked the order to make sure the medication is correct. Now what I have to do is I have to regulate the drip. So. Just give me a minute here. This is Carmel, Catania, and this is my drip rate. I'm doing 15 drips in 15 seconds. It would be a 60 drip rate. So I'm going to start, and then you can start whenever you want to. But okay. Start now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. There's my drip rate. Save it up there. Carmel, Catania. I'm going to be validating for changing a gown with a patient who has an IV, and I'm going to start with my 7 steps. I'm going to check the physician's orders, collect my materials, wash my hands, check that it's the correct patient, introduce myself, explain the procedure, and provide for privacy. Okay, so gown. And I'm going to start on the opposite side, making sure that the fresh gown does not touch the gown, the dirty gown. We'll start with the non-IV arm.